Hello guys, welcome back to my channel. Today we will be covering the other three electrolytes, their causes, signs and symptoms, and their treatment. So the first one that we're going to be talking about is magnesium. So magnesium reference range is 1.8 to 3.0 milligrams per deciliter. Again, make sure that you are checking these lab values with your book because lab values vary from book to book. So what are some causes of hypermagnesemia? So we know that serum magnesium level is greater than 3.0. So causes of this includes renal failure, diabetic ketoacidosis, and excessive magnesium intake. So what are some signs and symptoms? Here we are at the fun part. Our mnemonic for that is friend BMV. So the spelling is FRRENDDBMV. So let's go through them real quick. We have flushing, decreased respiration, decreased reflexes, EKG changes, nausea, dysrhythmia, drowsiness, decreased blood pressure, muscle weakness, and vomiting. So these are the general signs and symptoms that one may experience. So what are some medical management for this? So IV calcium gluconate. So magnesium and calcium are inversely related. So you increase calcium, it's going to decrease your magnesium. So IV calcium gluconate, loop diuretic, IV normal saline of lactated ringer, or hemodialysis. Let's move on to hypomagnesemia. So this is when your serum magnesium concentration is less than 1.8. What are some causes of hypomagnesemia? These include alcoholism, GI loss, enteral or parenteral magnesium feed, so it's not adequate. You have certain medications that can cause it. You have rapid administration of citrated blood, DKA, burns, or hypothermia. So these are some common signs or some common causes of hypomagnesemia. So what are some signs and symptoms? We have our mnemonic as TEAM CAN. So that is TEAM CAN with 3 Ds. Let's go through them. We have tremors, EKG changes, athetoid movement, muscle weakness, decrease in level of consciousness, altered mood, neuromuscular irritability, dysrhythmia, dyspepsia, dysphagia. So these are some common signs and symptoms that may be noted with a person who has hypomagnesemia. So what are some treatments that this person may get if they have hypomagnesemia? So definitely diet, increase in oral magnesium administration, and they might need magnesium sulfate IV. Alright, let's move on to phosphorus. The reference range is 2.5 to 4.5 milligrams per deciliter. Again, 2.5 to 4.5 milligrams per deciliter. So let's begin with hyperphosphatemia. You know that their serum concentration is greater than 4.5 milligrams per deciliter. And what are some causes of this? Renal failure, excess phosphate intake, excess vitamin D, acidosis, hypoparathyroidism, chemotherapy. So these are some causes of hyperphosphatemia. So what are some signs and symptoms? This one is simple. High school, HS, high school. Hypocalcemia and soft tissue calcification are some signs and symptoms, or the common signs and symptoms. Again, hypocalcemia and soft tissue calcification. So what are some treatments? What are some medical managements for a person who has hyperphosphatemia? You definitely want to decrease their vitamin D intake. You want to give them calcium binding antacids, phosphate binding antacids or gels, loop diuretic, normal saline IV, because that's gonna kind of dilute it out. They might require dialysis, and you want to definitely treat the underlying problem. So with all illnesses, you definitely want to target the underlying problem in order to correct these imbalances. Alright, let's move on to hypophosphatemia. We know that hypophosphatemia is when the serum phosphorus is less than 2.5 milligrams per deciliter. So what are some causes of hypophosphatemia? Alcoholism, refeeding after severe starvation, pain, heat stroke, respiratory alkalosis, hyperventilation. Pay attention to that. Hyperventilation, diabetic ketoacidosis, hepatic encephalopathy, burns, hyperparathyroidism, low magnesium, low potassium, diarrhea, vitamin D deficiency, diuretics, and antacids. So this is a lot of causes of hypophosphatemia. All you have to do is repeat going over it. Repetition is key in order to have these things down pat. Alright, so let's go into signs and symptoms. So the mnemonic for the signs and symptoms of hypophosphatemia is tic M&M plus B. Again, tic M&M plus B. So let's go into it. So tissue hypoxia, increase infection susceptibility, confusion, muscle weakness, neurologic change, muscle and bone pain. What is the treatment for hypophosphatemia? Simply replacement of phosphorus. So IV phosphorus is the treatment. And our final one for today is chloride. So our reference range for chloride is 96 milliequivalents per liter to 108 milliequivalents per liter. Let's get right to hyperchloremia. So hyperchloremia is if your serum chloride concentration is greater than 108 milliequivalents per liter. Alright, what are some causes? We have excess sodium chloride infusion with H2O loss, so it's water loss. Head injury, hypernatremia, dehydration, diarrhea, respiratory alkalosis, metabolic alkalosis, hyperparathyroidism, and certain meds. So definitely, again, these causes, you definitely want to pay attention to them and correct them as quick as possible. What are some signs and symptoms that you might note when a person has hyperchloremia? Our mnemonic for that is with control. So WTHCRL. Again, WTHCRL. So these include weakness, tachypnea, hypertension, cognitive changes, rapid respiration, and lethargy. So what are the treatments for hyperchloremia? You definitely want to restore electrolyte and fluid balance. Maybe you have to give them lactated ringer. Make sure you pay attention to their sodium and chloride concentration. You might have to give them a diuretic in order for them to micturate out that extra chloride. So you definitely want to do a fluid volume replacement. Definitely make sure that they're not dehydrated, because these are some things that can cause an increase in concentration of their chloride level. So let's talk about hypochloremia. So this is when the serum concentration of chloride is less than 96 milliequivalents per liter. So what are some causes of this? You may have Addison's disease, definitely a decrease in intake of chloride, GI loss, diabetic ketoacidosis. Remember, DKA has been mentioned, or DKA has been one of the main contributors of a lot of electrolyte imbalance. So you definitely, if a patient is diabetic, they have to pay attention to their glucose control. Alright, let's continue. We have excess sweating. If they have fever, excess burn, metabolic alkalosis. With chloride, if other electrolytes are being lost, such as sodium and potassium, you definitely know that chloride is being lost as well. What are some signs and symptoms that one may experience if they have hypochloremia? The mnemonic for that is AWISH CD. So AWISH-CD. So they may experience agitation, coma, dysrhythmia, weakness, irritability, seizure, hyperexcitability of muscle. Let's talk about seizure real quick. If they have gotten to the point where they are experiencing seizure, they are grossly hypochloremic. So you definitely want to make sure that you pay attention to their chloride level, and actually all of the electrolytes, as a matter of fact. Electrolytes help to maintain homeostasis within the body. If one or even a few electrolytes are off, it can cause a lot of problems. What are some management for a person with hypochloremia? You definitely want to give them either normal saline or a 0.45 saline or chloride IV. Make sure you pay attention to all electrolyte levels because they all play an important part in our bodies. Alright, that's it for today. Thank you so much guys for watching. I hope you enjoyed this video and I hope you found it helpful. I wish you guys all the best. Make sure you like, comment and subscribe for my latest videos. If you have any questions at all, as usual, you are free to leave a comment or send me an email. Once again, thank you for watching. All the best and good luck.